So this is our team. Me, Noadilin Fakir binti Muhammad Asahal 08DEU23F1058. And next one Edina binti Muhammad Rizwan 08DEU23F1094. And Nur Farah Fisha Ashila binti Ismadi 08DEU23F1139. And the last is Adila binti Salim 08DEU23F1172. So for executive summary, kita boleh ringkaskan kepada hacker staff athletic face challenge just as limited training, a new clinical procedure, terus continuous learning, hand-on practice and teamwork, they gain confidence use CPAP. CPAP implementation improve patient care and reduce respiratory distress, and the case studies show that training, support and teamwork are essential for successfully adapting for of new technology. So for introduction, advanced is medical technology improve how respiratory care is delivered. CPAP is a key innovation that keep away open and change oxygen flow. Introduction, CPAP requires staff to learn new procedure and adapt to new equipment and monitoring method. The case studies show staff overcome challenge through training, teamwork, and experience. And the LED, this led to increased staff confidence and better care for patients with breathing difficulty.
So here is the target market identification. Hospital first is hospital, which is to improve the quality and efficiency of respiratory care with CPAP implementation. Second is related to complication associated with respiratory distress and ICU dependently. And third is support the moderation of respiratory therapy, equipment and patient management. Second is in respiratory therapies, which is operate and enter the CPAP device for patient specific pressure setting. Second is monitor and evaluate the patient to respond to ensure the effective and safe therapy. Lastly, this require ongoing training to adapt to new CPAP technology and best practice. So lastly, we have the patients, which is patient to operate and adjust the CPAP device for patient specific the pressure settings. And second is monitor and evaluate the patient to respond ensure effective and safe therapy. And lastly is required to ongoing training to adapt to new CPAP technology and best practice. So here this is what market needs. First, we have growing demands for non-intensive respiratory support. So we have the rising case of sleeps like apnea, COPD, and respiratory distress, interest, CPAP adoption. So second is hospital that's prefer to non-intensive options to reduce the infection risk and ICU burden. So second, we have the technologies of advancement in CPAP device, which is the new model of features and auto pressure adjustment, humidification, and real-time data monitoring. So second, also we have the integration with digital health system, which is improve the patient follow up and compliance. So second is in patient comfort and compliance, which is need for lightweight and quieter, it's more quieter and user-friendly CPAP design. It's also comfort the improvement, the increasing of therapy, adherence and treatment success rates. So we so have training and sterilization, which is ongoing the profession development respiratory therapies and as a modern CPAP technology. It's also held in hospital required to the standard protocol for equipment use and maintenance. So lastly, we have cost-effective healthcare and solution, which is CPAP will provide the affordable respiratory support and compared to mechanical ventilation. And lastly, also will it support the healthcare system, implying for efficiency and reduce of operational costs. So here we have two, which is decision criteria and assumption. So firstly, we look at the decision criteria. So first is safety, which is CPAP provide the continuous positivity airway pressure to keep airway open, reducing risk of hypoxemia and respiratory confinement in proper pressure control, which is minimize the bad trauma and also ensure patient safety. For second is patient comfort. In patient comfort is modern CPAP system that feature quiet operation, lightweight design, and heated the human diapher that enhance the comfort and reduce the dryness and improve a long term of compliance. So we look at the assumption. So first is our respiratory therapists, nurse, we will see the proper training and CPAP setup, calibration, and patient monitoring. So second, they also clear the clinical protocols and SOP with established to ensure the safe, effective, and consistent use of CPAP equipment.
Okay, Assalamualaikum warahmatullahi taala wabarakatuh. My name is Nur Farah Fisha Sheila binti Ismadi. You can call me Farah. My matric number F0823 F1136. So I will continue about the analysis of the case. So the implementation of the continuous positive airway pressure is a CPAP, is a system took 3 months in a planning, installation, testing, and also training. So we gotta have a three phase to get the results. So for phase first is a needs assessment. It's and then also technical spec, and then after overall is we need to get the budget approval. After we get a budget approval, we go to the next phase is phase two is the installation, and then after installation we need to calibration and get a safety testing by biomedical engineers. So phase three is a staff training. We need to simulation practice. Uh, we have 2 months to pilot innovates. So for the result, um, is it to improve oxygenation, reduce complication lah. So next, so for the goals, we go to the perspective of staff training and knowledge limitation. So it's limited to understand tau because of some nurses and respiratory therapists struggle to fully understanding CPAP setting, moods and alarm function due to the short initial training session lah, and then also do alarm due to short training session also. So from that, we got the operational errors. How we know it's because of knowledge gaps occasionally result in an incorrect CPAP usage, and then also potential affecting patient care and safety. So for the solution, we need to implement structured refresher training and hands-on one-side demonstration by biomedical engineers and supplier to enhance staff competency and confidence. So, for the user adaptations, staff were more familiar with conventional oxygen therapy, so making CPAP adaptation initial challenging. So CPAP required careful monitoring of pressure, alarm, and patient response, and it also increasing workload. So for the user adaptation, need to also have a confidence and proficiency improve after several weeks of hands-on experience. So next is a financial cost. So higher initial costs because of CPAP machines, accessory, and staff training costs more than standard oxygen therapies. For the and because of that, we need to have a budget adjustment lah. So we need to additional funding was required, particularly for consumable and maintenance. For the long-term benefits, for the long-term benefits, it's improved patient outcomes such as reduced ICU stays and lower need to invasive ventilation. So it's lead to overall cost saving lah. So for the maintenance technical support, um, Regularly, we need to get a regular servicing. CPAP machine require routine calibration and maintenance to ensure proper functions. So what's the challenge? It's a limited staff and technical experts sometimes because of maintenance delay lah. So for the solution, need to have a calibrated with a supply technician and implement a prevention maintenance by the schedule to ensure the stuff. Yeah, that's all for me. Thank you.
Next, we go to the recommendation. First, staff training. Refresher courses and hands-on demonstration address knowledge gaps. Second, user adaptation. Confidence and proficiency improve as staff gain experience with CPAP settings and monitoring. Third, financial costs. Higher initial costs were justified by long-term benefits like reduced ICU stays and intubation rates. Fourth, the maintenance. Regular calibration and preventive schedule with supplier supports ensure equipment reliability. The last one is recommendation, which is implement structured training, clear monitoring protocol, preventive maintenance, and budget planning for suitable CPAP use. For the equipment overview, we have a CPAP machine which is provide continuous positive airways pressure to keep airways open. The second one is the monitoring and alarms for to track pressure, leaks, and patient status, alert staff to the issues. The third is tubing and the connectors. The flexible circuit that connect the machine to the mask and ensuring airtight delivery. And the last one is the mask and interface, which is we have a nasal or full face mask, deliver pressure comfortably to patients. In conclusion, the implementation of CPAP improve patient respiratory support by providing continuous positive airway pressure, though it requires staff training, careful monitoring, and regular maintenance. Initial financial costs were higher than standard oxygen therapy, but long-term benefits such as reduced ICU stays, lower intubation rates, and enhanced patient outcome justified the investment. Highlighting the importance of structured training, user adaptation, preventive maintenance, and proper budget planning for sustainable and effective CPAP use.